I'm Dr. Dirk Juschka, and I work with a company called Provectus. I'm co-owner and also the primary person doing administrative decisions. I also see patients. I have been doing this for 4 decades now, and for the last 2 decades have been doing exclusively long-term care. My daily workflow varies a lot from day to day, but there's not a day that doesn't go by that I'm not communicating with the rest of the team, the physicians and the physician assistants and the nurse practitioners, or the facilities. I would say most of my communication process does happen with the facilities, and this is where hucu comes in particularly usefully. We had searched for a long time for a good communication system, one that allowed us to effectively communicate all the different parties, but also were able to maintain an individual patient flow of information. This allowed us to be able to retrieve that information. So for example, if I'm doing rounds on a patient a few weeks after, I can look back at the communication since the last visit and refresh my memory on anything that was important that I need to make sure that I address during that visit. hucu has saved myself personally time and my coworkers time. It allows us to control the flow of information so that we're not continually interrupted all the time through the day and distracted and taken off task, having inefficient work time. Instead, we're able to channel the work to when it's optimal for us to respond, unless it's an urgent situation. Then, of course, we still can go ahead and respond immediately. The other thing that really impressed me with hucu was actually not just the system, but the people behind it, the people who allowed us to become really part of their family and be able to process potential changes, to listen to what we needed, to adjust hucu in a way that was allowing us to really maximize what the potential could be in the system and to make our jobs as easy as possible and our patients' care as good as possible.